Bismillahirrahmanirrahim. Synthesis and secretion of the adrenocortical hormones is discussed in this video. There are three distinct layers in the adrenal cortex. These are the zona glomerulosa, zona fasciculata, and zona reticularis. Here you can see that this blue area inside is the adrenal medulla, while this one is the outer cortex. So this cortex is made up of three layers. Outermost is the glomerulosa, the middle one is the zona fasciculata, and the inner one is the zona reticularis. So the outer one is the 15% of this uh, adrenal cortex, and it comprises of it causes the release of aldosterone, and the enzyme that is responsible is aldosterone synthase, and the control of this hormone is by the extracellular fluid angiotensin 2 and potassium. So this aldosterone secretion is independent of the ACTH. Then there is zona fasciculata that comprises of about 75% of the adrenal cortex, and it is the middle layer, and it secretes glucocorticoids that are cortisol and corticosterone. So the main glucocorticoid is cortisol, while small amounts of androgens and estrogen are also secreted from this zona fasciculata. The regulation of this area is by uh, ACTH or adrenocorticotropic hormone via hypothalamic pituitary axis. Then the inner one, the inner 10% is zona reticularis. This zona reticularis is the is responsible for secretion of adrenal androgens that are dehydroepiandrosterone and androstenedione, and there are also some estrogen or some glucocorticoids secreted from this area in a small amount. So this area, this zone or zona reticularis is also regulated by a increased ACTH or adrenocorticotropic hormone, and possibly by cortical androgen stimulating hormone or CASH, possibly from the pituitary gland. So remember that the aldosterone secretion is independent of the ACTH, and the cortisol and androgen secretion depends heavily on ACTH. Each zone responds selectively to different stimuli. The adrenocortical hormones are steroid derived, and they are derived from cholesterol. This cholesterol is provided by the low density lipoprotein, and 80% of the cholesterol is provided by this LDL, while 20% of the cholesterol is synthesized within the cell by the acetate. So these LDL, they go to the corticotropic hormone, adrenocortical cell by from the interstitial fluid through diffusion, and they bind with their receptor in the coated pit, and this coated pit is then endocytosed. This LDL is endocytosed with the coated pit inside the cell, and then it is added with lysosome. So with the addition of the lysosome, after the action of enzymes, the cholesterol is released, and all these activities were done with the action of ACTH in case of cortisol release. Then there is the enzymic action by the cholesterol desmolase that occur within the mitochondria, and then these cholesterol are converted into pregnenolone. This formation of pregnenolone is the rate limiting step in the in the synthesis of these adrenocortical hormones. So the cortisol or aldosterone or androgens, all three layers of the adrenal cortex, in all three layers this rate limiting reaction occurs. And if this reaction is under the control of ACTH, the cortisol is formed, or in case of aldosterone, this is not under the control of ACTH. Angiotensin 2 acts, and then it converts this into aldosterone. So all three layers of this adrenal cortex has got a specific enzyme activity. The glomerulosa is producing aldosterone and the cortisol is produced by fasciculata, while reticularis is responsible for the production or release of the androgens, and all these three layers are under the control of various factors. The glomerulosa is under the control of angiotensin 2, while the fasciculata is under the control of adrenocorticotropic hormone, while the this zona reticularis is under the control of ACTH and probably under the control of cash. Most of the activity of these hormones that are synthesized from cholesterol is it occurs in two main organelles, the mitochondria or endoplasmic reticulum. Each step is enzyme specific. Even a single enzyme change alter the hormone output significantly and can cause overproduction of abnormal steroids or sex hormones. There are some specific hormone structures that such as the cortisol having keto group on carbon number 3 and hydroxyl group on carbon number 11 and 21, while the aldosterone contains oxygen group on carbon 18. The enzyme guide each intermediate step in this pathway. A small mutation or dysregulation will lead to production of abnormal or excessive steroid or excessive androgen that lead to various characteristics. And there are some other activities by hormone. For example, the corticosterone is a weak glucocorticoid, and 11-deoxycorticosterone is that is also derived from adrenal cortex, has got some mineral corticoid activity also. Prednisone and dexamethasone, prednisone or dexamethasone, they are synthetic potent glucocorticoid that are used in therapy, and fludrocortisone is also a synthetic molecule that is used for mineral corticoids. So a small change in the enzyme will result in big changes in the production of the hormone, and regulation and proper enzymic control are critical to avoid hormone imbalance and clinical disorders. This image is showing the synthetic pathway of adrenal steroid hormone, starting from cholesterol. the common precursor for all steroid hormone. It outlines how cholesterol is enzymatically converted into three major classes of the adrenal cortex hormones, that are the aldosterone, cortisol, and androgens. So the cholesterol, that is C27H46 and O, it is acted by
सर वो कल हम मेडिकल स्टोर से है ना सर, वो लिस्ट मुझे करवाने दी थी, तो उनको क्या करना है?
रजिस्ट्रार। पहले मैंने क्या लिख के दिया? ये
सर
दोबारा आप
उनको
न्यू लेके आ गई।
सर उन्होंने होल्ड ही नहीं किया। मैं तो कह रही थी ठीक है मैं करके दे दूँ।
नाम से जाती है कि एप्लीकेशन?
मेरे सामने कह रहे हैं साइन भी मेरे पासपोर्ट वाले करते हैं।
सोलह।
जी
So dehydroepiandrosterone is formed by the action of lyase, and then this dehydroepiandrosterone, or DHEA, is converted into androstenedione by the action of 3-beta hydroxysteride dehydrogenase. So this androstenedione is formed, and it is precursor to the sex hormone like testosterone and estrogen. So the key enzymes, many key enzymes are involved in this process, and each enzyme is essential in determining which hormone is produced. Any enzyme deficiency can lead to clinical disorder like congenital adrenal hyperplasia. This is a comparative table of both the adrenal steroid and synthetic steroid, and this is summarizing their average plasma concentration, both the free and bound form per microgram, that is shown in microgram per 100 ml, and average amount secreted is expressed in milligram per 24 hours. There is glucocorticoid activity as well as the mineral corticoid activity of all these hormone, that is shown in this table, and it is to remember that glucocorticoid and mineral corticoid activities are relative to cortisol, which is defined as 1. So the adrenal steroid and synthetic steroid both are described. So these, so cortisol has got the value of 1. Both these activities are graded or counted on the basis of the cortisol. That has got one uh, relative term, one glucocorticoid activity and mineral corticoid activity. The corticosterone has got zero point 0.3 or one third of the glucocorticoid activity, while the mineral corticoid activity of corticosterone is 15 times of the cortisol. Then the aldosterone has got potent mineral corticoid activity about 3000, while 0.3%, only 0.3 of the glucocorticoid activity is by this aldosterone. Then Deoxycorticosterone has got 100 times mineral corticoid activity of the cortisol. Then the synthetic steroid also got the effect. Synthetic cortisone has got zero point 0.7 of the glucocorticoid activity, and mineral corticoid is zero point 0.5 or half. Prednisolone has got 4 times glucocorticoid activity of the cortisol, while it has some mineral corticoid activity. Methylprednisolone has got no, and the dexamethasone has got no mineral corticoid activity, while they have got the fairly potent glucocorticoid activity. Then the 9-alpha fluorocortisol has got 10 times of the glucocorticoid activity, while it has got some about 125 times mineral corticoid activity of the cortisol. So this table is showing that aldosterone has extremely high mineral corticoid activity, that is 3000x that of the cortisol, making it a key hormone in the sodium and water retention. And dexamethasone has a very high dexamethasone, that is the synthetic steroid. This has got a very high glucocorticoid activity with no mineral corticoid activity at all, making it potent for anti-inflammatory uses. And 9-alpha fluorocortisol is powerful in both the activities, the mineral corticoid as well as the glucocorticoid activity. Thank you for watching this video. If you have any query, please write in the comment box.